It's a parent's worst nightmare.
They weren't regular bruises, and they were all kind of spread out all over her body. And when I would feel the bruises, they would have little notches on them. And it was just very bizarre.
Thinking it just may be normal growing pains, in May, Nick and Tina Tobiasen took their 4-year-old daughter Kensley to the doctor. Never in a million years could they imagine what the diagnosis was.
Looking at the test results from earlier in the day, they had kind of come to the same conclusion and said, we don't want to necessarily alarm you, but we think we're dealing with cancer for sure.
4-year-old Kensley was diagnosed with chronic myelogenous leukemia. Not only would Kensley be fighting leukemia, but Dr. Laborde with Kalispell Regional Medical Center says this type of cancer is rarely found in children.
It's about 3% of all pediatric cancer would be CML, so less than 500 cases in the United States per year.
CML differs by the genetic marker found on the patient's white blood cells.
And they said chronic myelogenous leukemia. And I'm just like, wow. It was just, my heart just sank. It was just like, how could this happen to us?
With this shocking news, Kensley and Tina flew to Colorado for more tests, leaving the Tobiasens' 2 other children at home.
Now I got to be Mr. Mom, it's all at the same time. So it was, phone calls saying, this is what's going on in the family, not going to be able to come into work, and we've got things going on, and having to take our oldest to school yet, and care for our 1.5-year-old.
Thankfully, Kensley's rare cancer can be treated locally, right here at Kalispell Regional Medical Center. It's not IVs that help Kensley's cancer. Kensley takes a pill that Tina dissolves in some apple juice. And she's responding well to treatment, with white cell blood counts returning to normal. But it's not the end of the road yet. This rare pediatric cancer doesn't have a clear long-term treatment plan.
We don't know in long term how long she would have to take this oral medication.
Doctors will continue to monitor Kensley's health, but for now, she's on the road to remission. In Kalispell, Marin Sue, MTN News.